Okay, what is the most likely diagnosis? We've got a Brenner tumor, a dermoid cyst, a fibroma, a granulosa cell tumor, or a serous cystadenoma. This is a 40-year-old woman who presents with pelvic pain and discomfort. She reports that the pain has gradually been increasing over the past few months. Pelvic exam reveals an adnexal mass on the right side. Imaging studies confirm the presence of a solid, well-circumscribed mass in the right ovary. She undergoes surgery to remove the mass, and histopathological exam demonstrates a benign tumor composed of spindle-shaped fibroblasts. So we definitely have like no like any sort of symptoms outside of pain and discomfort. So that makes a granulosa cell tumor incredibly unlikely because those would produce hormones. Which leaves us with like our kind of like vague. It's not a cyst, it's a solid mass. Yeah, it's a solid mass, so it can't be a cyst. Brenner tumor would have a uroepithelium, so like the transitional epithelium, so that's wrong too. And then a serous cystadenoma would again be cystic, and then it would be just like filled with fluid. So a fibroma matches the histology the best.
Good, good. You worked through that really well, right? Like, that's kind of exactly how I would kind of work through it, right? You kind of working through your way, using what you do know, right? And then kind of making the educated guess in a sense, right? A fibroma is the only one that kind of really fits here, right? Because it's solid, right? You might not know that has fibroblasts in it, but fibroblasts just is just kind of help you with scarring and things like that. So it can create a fibroma, right? But definitely for sure, it's a benign thing, right? It doesn't secrete hormones. It's not cystic. It's not fluid filled. So then you can kind of narrow it down to fibroma. So that's good.